Snoring? We joke about it, tease our loved ones, and brush it off as harmless noise. But what if that sound is actually your body crying for help? In this video, we're uncovering the truth behind snoring and why ignoring it could be a serious threat to your health. What is snoring really? Snoring happens when airflow is partially blocked during sleep, causing the tissues in your throat to vibrate. It's common, but when it's loud, frequent, and paired with fatigue or gasping, it could be a sign of something more dangerous. Obstructive sleep apnea. Sleep apnea is a condition where your breathing repeatedly stops during sleep. These pauses can last for seconds, and they happen over and over again throughout the night. Each time, your oxygen levels drop, and your body jolts awake to restart breathing. You might not even remember it happening, but your heart definitely does. This isn't just about poor sleep. Sleep apnea puts enormous stress on your cardiovascular system. Over time, it can lead to high blood pressure, irregular heart rhythms, atrial fibrillation, increased risk of heart attacks and strokes, and in severe cases, sudden cardiac arrest during sleep. Why? Because your body is repeatedly starved of oxygen. And when oxygen drops, your heart and brain go into emergency mode, night after night. Many people live with sleep apnea for years without knowing it. They feel tired, irritable, and foggy during the day. They snore loudly at night, sometimes even stop breathing for a few seconds. But they never connect the dots. And that delay in diagnosis can lead to serious, even life-threatening consequences. What you can do. If you're wondering what to do and how to save yourself, stay tuned for the next episode. It could make all the difference.